when I have a patient that comes in asking for possibly a facelift, there are several areas on the face I would evaluate to judge whether they would be appropriate for that type of procedure. Some of the main things I look at almost immediately is, do they have jowls, the jowling here, like I'm getting here, maybe I'm due for a facelift. You get this heaviness in the jowls. I also look for looseness in the skin. Is there this looseness that I can really change that's going to improve the whole overall jawline? So we want to make this nice and smooth. We don't want this dip in the jowls anymore. So that looseness can translate to more dipping, more wrinkles. Maybe we look for wrinkles in the face in this general area. Also, do they have deep nasolabial folds? A lot of times, and even into the marionette, when those are deep and there's a lot of looseness involved, sometimes just lifting that up can really make a huge difference. Another area I look at, is there loss of volume up in the cheeks and entering into the mid-face? So again, that's an area where we can improve on by adding volume back in addition to lifting. So we add volume back usually with fat grafting. And then looking down the face more, I also look into the neck. Is there looseness? Do they get that turkey gobbler, loose, creepy looking skin? That's going to be improved with a facelift. Another thing also that I evaluate in the neck is the muscles. Do they have looseness in the muscle with platysma banding? Like I have some of that here. You could see this, and those are other things we address with that mid and lower facelift by adding in the neck lift. Those are some areas that are really important when I first evaluate patients on what we can do to correct those things. So if you're concerned about any of these things, come on in, we could talk about it. There are other things to do, even less if, say, your skin is pretty good still, you just got a little jowls here, a little extra fullness here. Sometimes a little liposuction, a little mini tightening in different areas can be just as beneficial without doing a whole lower facelift. So give me a call and we can discuss it.